Hello and welcome. Today we're diving into a common yet potentially sight-threatening eye condition called branch retinal vein occlusion or BRVO. We'll explore what it is, what causes it, and what can be done about it. Let's get started. So, what causes BRVO? The primary culprit is the hardening of the arteries or atherosclerosis. When an artery that crosses over a retinal vein hardens, it can compress the vein, slowing blood flow. This compression, along with other factors like high blood pressure or inflammatory conditions, can lead to a blockage or occlusion in the vein. Let's understand the how. When a branch retinal vein becomes blocked, blood backs up, causing pressure to build within the tiny capillaries downstream. This increased pressure damages the capillary walls, leading to leakage of blood and fluid into the surrounding retina. This leakage can cause swelling of the macula, the central part of the retina responsible for sharp, detailed vision. Reduced blood flow also starves the retina of oxygen, a condition called ischemia. Both macular edema and ischemia contribute to vision loss in BRVO. BRVO is fairly common, especially among older adults. Studies show that it affects approximately 1 to 2% of people over the age of 50. The risk increases with age and is significantly higher in individuals with pre-existing conditions like high blood pressure, diabetes, glaucoma, and cardiovascular disease. The signs and symptoms of BRVO can vary depending on the severity and location of the blockage. Many people with BRVO experience sudden, painless vision loss in one eye. Other symptoms include blurry or distorted vision, blind spots, or difficulty seeing in low light. Sometimes, there are no noticeable symptoms at all, and the condition is discovered during a routine eye exam. Diagnosing BRVO typically involves a comprehensive eye exam. Your ophthalmologist will use several tools, including an ophthalmoscope to examine the retina, optical coherence tomography, or OCT, to assess retinal thickness and identify fluid buildup, and fluorescein angiography to visualize the blood vessels and detect any leakage. These tests help confirm the diagnosis, determine the extent of the damage, and guide treatment decisions. While we don't traditionally classify BRVO into rigid subtypes, the severity and location of the occlusion are key considerations. Some cases primarily involve macular edema, while others are dominated by ischemia, the presence or absence of neovascularization. The growth of abnormal new blood vessels also plays a significant role in determining the appropriate treatment strategy. The goal of BRVO treatment is to stabilize vision and prevent further vision loss. Treatment often focuses on managing macular edema and neovascularization. Anti-VEGF injections are a common treatment for macular edema. These medications block a protein called vascular endothelial growth factor, which stimulates fluid leakage and blood vessel growth. Laser photocoagulation may be used to treat areas of retinal ischemia and to prevent or treat neovascularization. In some cases, steroid injections may be considered to reduce inflammation. While there's no guaranteed way to prevent BRVO, managing risk factors is crucial. Regular eye exams are essential, especially for individuals with high blood pressure, diabetes, glaucoma, or cardiovascular disease. Controlling these underlying conditions through diet, exercise, and medication can significantly reduce the risk of developing BRVO. The prognosis for BRVO varies depending on several factors, including the severity of the occlusion, the presence of macular edema or ischemia, and the response to treatment. With prompt diagnosis and appropriate management, many people with BRVO can maintain useful vision. Recent research is exploring new treatment strategies, including sustained-release drug delivery systems and novel anti-VEGF agents that hold promise for improving visual outcomes in BRVO. Gene therapy is also being investigated. Always consult with your eye care professional for personalized guidance and the latest treatment options. Thank you for watching.